And President Biden is now banning travel from South Africa over concerns about the variant there and reimposing a ban on some 24 other countries. ABC News contributor Dr. John Brownstein is here to unpack it all for us. Dr. Brownstein, how concerned are you about these variants from the UK, South Africa, Brazil? And will new travel bans help, especially considering the UK variant is already here?
Yeah, thanks, Diane. I think that I have a healthy amount of concern about these variants, right? They are building up mutations. They are seeming to be more transmissible, up to 50 to 70% more transmissible. And now with these new small amounts of data showing more deadly, that is concern. Now, we should caveat with the fact that this new data out of the UK is based on small sample sizes. It also could be related to the fact that health systems are overwhelmed. But either way, we recognize that these variants can quickly take hold and overwhelm our health system. So yes, on one hand, a travel ban is helpful because it limits the numbers of people coming in that are infected. But we should remember, we've had travel running rampant, and these variants have emerged here. So I'm not sure how much they will do actually in terms of limiting our ability to see these variants emerge. We should have been implementing testing, pre-travel, post-testing, as well as quarantine. Of course, those things are coming into play now, but we should have been doing those things all along. And of course, the concern around the vaccines, good data coming out about the South African variant being having a good effect towards the vaccine. But the concern is, what does future mutations mean for this vaccine? And so we need to be thinking about reformulations of vaccines. And just most importantly, if you have available vaccine to you right now, that's the best thing. Get your shot while you can get it.
Well, and let's talk about that availability, because the CDC says, I think it's roughly 41 million doses have been distributed. Nearly 22 million have been administered. And yet some states are temporarily canceling appointments right now, saying they don't have enough supply in stock. So what's going on with that? And how much does the fact that Johnson & Johnson now says their phase 3 trial will be out soon, how critical is that to trying to improve this rollout and finally getting things where they need to be?
Yeah, I'm a little bit confused by some of these statements because as a group that runs one of these platforms for the CDC, there's a good amount of visibility. I think part of the issue is in supply chain and getting the vaccines to the places where there's demand, and public health systems are well overrun. And so there are pockets that have extra vaccine and places that don't. And this is why we have to focus so much on logistics. But yes, supply is super important too. And this J&J vaccine and the data coming are so hopeful. I mean, today we heard that Merck paused their vaccine development. So that takes out a really exciting candidate out of the mix, puts a little bit more pressure on J&J and of course, AstraZeneca. What's exciting about J&J is that it's a one-shot vaccine, which will make logistics so much easier, also in terms of storage. So we don't fully know how much supply J&J has to offer, but of course, any amount will help in this current situation.
And you said supply is super important, but the CDC director said this week she doesn't know how much supply the federal government has in the currently approved vaccines. The press secretary from the White House echoed that today. So how is that possible, first of all? And if they don't know what the supply is, how can they figure out how much to give each state?
Yeah, I think it's a little bit of an exaggeration because, we look at this data daily. We know that there's what has been distributed. We know what's been injected. I think there are important data lags. States don't always report back to the CDC in real time, so we don't have full visibility. And so we don't have the full picture. But I do think that we have a sense of where there's stockpiles and where there are issues in administering the vaccine, right? We know that hospitals do have excess supply. CVS and Walgreens are trying to get this vaccine out to long-term care facilities. Probably they're saving second doses, but I think overall there's just a slow accounting of the data. So we just need to improve the coordination that's happening between states and the federal government, because with that, then you can identify where there's gaps and need. Right now, there's just been so much limited communication that, of course, there's a lack of that visibility. And without that visibility, we keep hitting these obstacles over and over and over again.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.